The scale of the need is so immense, and in spite of the great work that's being done, the need is still growing. So business as usual is not going to cut it.
The strategic partnership between Cure Blindness Project and the Fred Hollows Foundation that we are officially launching has just incredible potential because this problem is so big that no one organization can or will solve it.
KT, so good to be able to chat today. With Cure Blindness Project, tell me about the things you've seen in the field and how that's impacted you.
I always think that it is such a privilege to do the work that we do, right? And every time I'm out in the field and I see people whose lives have been impacted by losing their sight, and then you see someone whose sight is restored, and just the pure joy. Obviously Fred Hollows Foundation does such amazing work in this area. I'm sure you've had those similar moments as well.
Yeah, since joining the foundation just on a year ago, it's been an amazing privilege to see the impact of the work done in so many different parts of the world, remote Australia, parts of Africa, parts of Nepal. I can think of so many examples where I saw someone have the patch taken off and you realise that you see the joy in someone's face, but you also realise that just the transformational impact and what that shift means for that individual. I do recall a time in Nepal where I saw a patch come off. It was a husband and he was seeing his wife for the first time for many, many years. Now, he said he was a very smart guy, but he said, "You're more beautiful than I ever remember you being." So, yeah, I think what we see is just this amazing transformation in someone's life and the hope that comes with sight restored.
Yeah. And what's amazing too is you realize how that individual's life has completely changed, but it's not just that individual, right? It's the entire family and in some cases the entire community. And, I'm always reminded the impact of avoidable blindness, on somebody's ability to learn, their ability to work and support their family. I share these stories with people and they're always amazed, but I think people sometimes forget just how big of an issue this is, right?
It's, if we think about the global scale of the issue, so the statistics are pretty sobering. So let's say probably about 1 billion people at the moment suffer from some sort of vision impairment or blindness. That number is forecast to grow by 2050, just on the basis of an ageing population, to about 1.7 billion by the year 2050. So, but I guess the really sobering statistic, or maybe the hopeful statistic, is that 9 out of 10 of those people who suffer from visual impairment actually don't need to experience that. And so this is a problem that actually has a solution, and we have some known and really well-tested and implemented approaches. So it's a big problem, but we have a solution that can really transform lives and communities.
It's so true. And, the other statistic that always really gets me is the fact that when we look at people who are facing blindness or visual impairment, 9 out of 10 live in low and middle income countries. Where you happen to be born should not determine the quality of your life and the ability for you to access care that, as you said, we have the solution. We know how to solve this problem, and it's just a matter of getting that solution to the people who are most in need of it.
Yeah, absolutely. So, a 15-minute surgery in many cases can just be so transformative, very powerful when you see that in practice.
It's a matter of really being able to scale that solution and also make that solution local, right? So we know that the expertise may lie in places like Australia or the US, but the really long-term solution to this problem is making sure that that expertise is in the countries where the need is. Both of our organizations have such a strong history of helping to build that capability and training local doctors and equipping, sometimes building facilities, making sure that we have the right nurses. We're not just addressing the backlog of cataracts, for example, but we're building a system that can help get out in front of the needs of the patients there.
Yeah, I think it's so important that whatever approaches we take really have at the core this notion of locally led development. And I think for Cure Blindness Project and the Fred Hollows Foundation, that's really core to our ethos. And I can think of so many parts of the world where our respective organisations work, where you see just this remarkable story in history of actual local ownership and the ability to build systems that in fact carry on long after our work has actually been finished. Earlier or late last year, Vietnam is a great example where we saw a young child come to Australia whose sight had been restored. That young child is now a 40-year-old father. He's a maths teacher. And so a story of one life transformed, but in fact a whole nation transformed over the last 30 years. And so back when the Fred Hollows Foundation started working in Vietnam, I think there were only a very small number of surgeons who could perform cataracts. There's now more than 1,000 surgeons trained in the country. You have a national health system that provides insurance. So you actually have a national level transformation that's actually occurred. And that's incredibly powerful when we see that work in practice. And of course, the many countries we work in all have unique challenges, but this primary focus around locally led partners is so important for both of our organizations.
Absolutely. And, similarly, so when I look at some of the places where our organization has worked or where both of our organizations have worked, and you see the progress over the course of the last 30 years, and you do see the arc of blindness actually bending. But by the same token, I think we also both know that we both work in places where there's still so much to do. And, I think about the need, like I said, to address the backlog, build some of the systems, introduce policies. But there's also an important need to educate patients and make sure that they're aware that they actually don't need to be blind and that these, care is available. And, you mentioned someone who had, gotten their sight and how it led them to a whole new career. We now, as a sector, we have such incredible data to show the power of restoring people's sight. Recently there was a incredible investment case that was done, partially led by Fred Hollows Foundation. And, it really shows the impact of the work that we do.
We're really delighted to be involved in producing a report called The Value of Vision, which really set out the economic case for investment in eye health. Amazingly, and I guess really supported by robust research that had been done, proved out that the return on investment, so you spend $1 on eye health, the return on investment is around 28 times. It's a profoundly impactful intervention. How do you measure that? You think about what happens when someone has their sight restored. So that could be a return to vocation, it could be a return to livelihood or whatever it is that they're doing in their particular communities. And so you have something north of probably $400 billion of economic productivity returned on an annual basis. So over and above the restoration of hope and joy that you see with someone who can see again, the economic case is just really robust.
It is so powerful. And I think one of the most remarkable things about that report is looking at not just the incredible ROI, but really the incredible impact on so many different aspects of life. As you mentioned, it's a return to vocation. It's also an impact on the number of education years that can be restored, the number of people who no longer are in traffic accidents. Even when you think about this from the Sustainable Development Goals, none of them specifically reference vision, but we know that vision directly impacts at least 8 of the 17 goals. And so this work becomes so important, again, not just for the individual whose sight is restored, but if you think about the impact on important issues like gender equity or education, and some of these areas that we've touched on, we know that this is an incredibly important effort to end avoidable blindness.
Yeah, I think it goes way beyond just eye health. The eye is the window to the soul, but it's also the window to the broader, development practice in a community. And as you say, education, gender, economic livelihood, even climate, there are so many aspects that actually have direct adjacency or link with what's happening with someone's eyes. And that's why we think that investment in eye health and the work we do actually has such a profound impact that goes way beyond just the immediacy of restoring sight to an individual.
Eye health is not just a health issue. It is truly a development issue. We know that eye health can be a cause as well as a result of poverty. And when we think about our world even more broadly, really working toward ending the avoidable blindness is part of the effort to break the cycle of poverty.
And when we know the statistic that 9 out of 10 people who suffer from vision loss or blindness don't need to experience that, but they are disproportionately represented in the developing world. And that's why we do the work we do and focus on the geographies and parts of the world where we work. When I was visiting a very remote project in a place called Jimma in the Oromia province of Ethiopia, a village elder said to me, when you restore sight, you change a life, but you also change a family. And when you change a family, you change a community. when you change a community, you change a nation.
Agree. I don't think it's overstepping to continue yours to say, you change a community, you change a nation, you change the world.
The challenge is enormous. And whilst great work is being done, we both realise that collaboration across the sector is critically important. And so we deeply value the partnership we have with Cure Blindness Project in many of the places we work. But so excited to be able to talk more today about, I suppose, even a more intentional way of how we leverage the two organisations to come together to solve some of these issues.
Well, and I share your excitement. I think the strategic partnership between Cure Blindness Project and the Fred Hollows Foundation that we are officially launching has just incredible potential because this problem is so big that no one organization, can or will solve it. But I think by coming together, we bring both our organization's respective strengths, but also the opportunity to work together with governments, work together with our local partners, work together with broader institutional organizations to start to mobilize that solution and do it at scale.
One of the things we often say internally is that when the scale of the need is so immense, and in spite of the great work that's being done, the need is still growing. So business as usual is not going to cut it. So business as unusual, how do we challenge ourselves? How do we think innovatively? How do we think differently about how we work together? And so obviously we've done a lot of thinking and planning about which parts of the world make sense, where is the opportunity and the need most apparent. And I guess two immediate focus countries being Rwanda and Laos. Do you want to share a little bit about your knowledge of those two places and I guess the areas that we're looking to work together on?
So both Rwanda and Laos represent really unique opportunities. In each case, both countries have a pretty significant backlog of cataracts, of people already waiting for care. But we know that without an intervention, vision impairment in both countries is going to grow significantly. In fact, by 2050, it could be as much as 1.2 and 1.7 million respectively. And yet, both countries represent huge potential for building the systems. We know that we've got fantastic partners, both locally as well as with government, others who are working there. And I think by bringing our skills together and our expertise together, we know that we have the opportunity to really build up the capability in the country while simultaneously addressing some of the backlog of care that is needed.
I completely agree. And I think the really exciting thing is that there is an end goal here that is achievable in both of these locations. And if we can unlock the capabilities and the resources of the respective organisations and the great partners that we're working with, you actually have the ability to have really quite transformative impact. And I think that's very exciting for us.
And I think it's not just exciting in those countries, but looking at those countries as sort of a concept that which once we do that, I'm looking forward to seeing how we scale that further.
The other aspect of this, I think that's so important to understand, is the ability to reach the hearts and minds of our supporters in a different way as well. And our supporters, of course, they are very generous in the support they provide for us, but being able to see their dollars well deployed and scaled in collaborative and innovative partnerships, I think is also a great story for the supporters and the markets that we're working in.
Couldn't agree more. And in fact, I know for both of us, we're so grateful to the many, many people over the years who supported our work. And yet I look at this partnership as an opportunity for people to take this to the next level. Cure Blindness Project has a deep history in high volume surgical outreach, training, particularly those at the specialist and subspecialist levels, as well as operational excellence. And I think coupled with the, really impressive strengths of Fred Hollows Foundation, particularly in systems strengthening, policy, and some other areas, I think we really have a strong combination.
Yeah, I think it's really powerful when you think about the history of the two organisations and the respective capabilities we bring. And certainly, as you say, for the Fred Hollows Foundation, likewise, we have a broad global footprint, but deep long-term investment in partners in all of the places that we're working. And we do take a systems approach. We're always thinking about where we work and how our efforts can help build and strengthen systems so that the work actually continues long after we have left. And as you rightly say then, also from a global policy standpoint, we recognise there's a very powerful sort of bottom-up and a top-down element if we get those elements right. And so we continue to seek to advocate and influence and partner at a global level and at a policy level with governments, as does the Cure Blindness Project. It's very powerful if we can bring those things together. And power of partnership is always thinking about how we leverage the considerable strengths and capabilities of the two organisations.
Completely agree. I think one of the things that is really powerful about this partnership is we're united by our absolute commitment to addressing the needs of individuals now, but making sure that we're also thinking about the long-term sustainability of the solutions that we bring.
And if we think about just immediate or outputs over the next five years, what we're targeting is over 177,000 cataract surgeries. Equally trying to couple that with a whole range of aspects of strengthening of systems, investing in workforce development as well as being able to trial and innovate around some new models of healthcare. Again, the power of partnership, I think, enables us to deliver very tangible, concrete outcomes in the short to mid-term, as well as the longer-term system strengthening we've spoken about. But what are your perspectives on that?
I believe both of our organizations are committed to ending avoidable blindness in both of these countries by 2035. As we think about the work in Rwanda, one of the pieces that I know we both consider to be so important is really building that locally led system and solution. And, I think one of the things that makes that country so special is there is an incredible slate of partners there, from government to local physicians, academia, as well as the ophthalmological and optometric societies. And they are ready for this, and they are eager to work together with our organizations. And I truly believe that together we can build that solution that truly ends avoidable blindness there.
We also have a great conviction that working together can unlock new and catalytic investment pathways. And all of this aligns deeply with our shared approaches around innovation. We think that if we are successful in this collaboration, it models to the sector and to our partners newer and hopefully innovative ways of working, but equally unlocks new investment pathways. And I know both of our organisations are deeply engaged in thinking in catalytic ways about how and where our work can actually raise additional resources to solve the issue that we have around the elimination of preventable blindness.
Absolutely. And the reality is that to actually tackle this problem at the scale that we aim to, it will take an investment. And while we know that there will be an incredible return on that investment, it's one of the reasons that I know we're both very grateful to our supporters. But it's also, part of that power of this partnership, which is by coming together, by bringing our respective strengths together. I do believe it's a really incredible opportunity for us to work with our current supporters as well as new funders who recognize this as an opportunity to significantly accelerate. Collaboration at this level is what is needed to unlock the investment that will eventually change so many lives.
I agree, KT, and I think investment in eye health is one of the most impactful ways to change the lives of over 1 billion people. That's why we're so motivated by this work.
It's not only an area that has such a great impact, but we know we have the solution. We know that it is solvable. We know that that is scalable. And it's just a matter of actually bringing that solution to the people in need. And the partnership that we are launching today is a huge step forward in actually doing that.
Yeah, Katie, I feel exactly the same. We're so excited and delighted by the potential of this partnership. And I think by working together, avoidable blindness can become a thing of the past.